right? No, I guess let's make sure.
Okie dokes. We are back.
We're back.
Sorry about that. We had like a
Whoops.
weird temporary power loss that
Yeah.
happened.
I don't know why that happened. Strange.
And it was just like real fast, but it could knocked out our internet. So nothing we could do about that. So anyways, I was saying like it's been shown to be able to even prompt the creation of new blood vessels and improve blood flow through some of the smaller vessels as well.
And people don't realize that improving blood circulation, even within like non-specific circuits or pathways, I should say, that is going to also have incredible effects on just like vital amino acid and nutrient transport within the body and in the brain. And so,
and as much as we love to segment the nootropic to the brain itself, and optimizing that, which in a large part is, you can't disconnect the brain from the body. There's a lot of overlap there. If the body's not optimized and isn't functioning properly, and your cells aren't functioning properly, your blood flow isn't functioning properly, and your brain isn't going to be functioning properly.
And especially when we have stress, incredibly stressful conditions that we place our body in, we need adaptogenic like compounds or ways of minimizing that damage. And it's Emoxypine Succinate's ability to kind of act as a vital antioxidant defense mechanism, and not just your brain, but in your heart, in your liver, and your metabolism. It's doing all of these things simultaneously and acting as this like stress resilience kind of defense mechanism, and is going to generally increase health and your ability to adapt and minimize stress. And that's also one of the other things that it does, is that during highly stressful environments, the increase of HPA axis activation is something that it's able to actually regulate, because under very stressful conditions, this axis gets way overly activated and sometimes isn't able to actually calm itself down, and you get things like adrenic depletion, for example, and that's not good. And Emoxypine Succinate can actually regulate your HPA axis to reduce the activity of your HPA axis, and gives that anxiolytic effect, is able to restore that kind of vital connection between your hypothalamus and your pituitary gland. And
the one of the things that we missed when the connection cut out that we went over was that the detoxifying properties that it has, and the fact that beyond just the brain effect, it can have it seems to be able to help protect the liver, and can help reduce the toxicity of alcohol, as well as help with things like hangovers and whatnot. And another example of its kind of really wide range of functional application. So what were some specific of the specific studies that jumped out at you? Because I know that there's been a lot of studies done on it, not here primarily, but a lot of studies both on rats and on humans that have been done on this one, which is a nice break from the lack of human studies and lack of studies.
There's been some pretty good studies. I would say probably I really like kind of that first study that's kind of in the meta-analysis That's about that's showed how severe kind of injuries affect brain cells, and if Emoxypine Succinate can actually help. And so they used a sample of like 104 male rats, and they treated the rats with Emoxypine Succinate for 14 days, and they measured the signs of cell damage and death in white blood cells for a month. And it showed that it reduced the harmful effects of injury, and also it decreased oxidative stress by 40% and improved the cell's energy status by 35% and reduced cell death by 16%.
Wow.
And so those are some actually pretty good numbers.
Yeah.
I will say. So I found that to be pretty good. Do you have any that are like human based that you like?
Well, I have one that I is not that I of the rat studies that I found particularly interesting, and it was actually a study done on rats using a stroke model, but the goal of the study was to determine if Mexidol can help, which again is Emoxypine Succinate, can help increase a second here, I'm double checking our audio levels, make sure, okay, can help increase neurogenesis after a stroke. And so they were specifically kind of looking at this in the context of BDNF in the brain.
Yeah.
And they found that Mexidol actually significantly increased levels of some of the key proteins within the brain that promote the growth, production, and survival of neurons and nerve cells.
Yeah.
As well as blood vessels
Mm-hmm.
In the damaged areas of the brain in the rats. And that was done after a single dose. That was measured after a single dose.
Wow. That's pretty cool.
So that to me was like very significant and telling as far as its benefits goes. Because like, I mean, chances are very few people's brains are always optimal and optimal levels. And, you know, throughout life, you know, we go through stress and traumas and exposure to chemicals and all this other stuff that like can affect those factors.
Yeah.
And so even if we might not be dealing with something that is causing overt, like, regular dysfunction within our brain, chances are we all deal with some level of dysfunction.
Yeah.
You know,
absolutely.
And we all, as adults, we tend to our ability to promote neurogenesis tends to decrease, which has implications, you know, for our overall mental health, you know, and using that in a very broad context term, not in the context of emotions, but our broad mental health. And so that to me is a significant benefit to this in and of itself by helping to influence and promote kind of an optimal BDNF environment. You know?
Yeah, that's pretty cool.
There have been some, you know, human trials done on the stuff. There was a controlled clinical trial done with patients with chronic cerebral ischemia.
Oh yeah.
And their goal there was to assess its safety and efficacy of multiple treatments of Mexidol for treating brain ischemia.
Which usually leads to pretty significant cognitive decline.
Yes.
Yeah.
And that was their assessment was done based off of the testing their cognitive abilities via the MoCA scale, unfortunately, as far as I could tell in my research, the actual results of that trial were not made publicly available, which seems to be weirdly common. But there was another one that was done, which was a study with 318 patients with chronic brain ischemia, and was a multi-center randomized double-blind placebo-controlled trial, very rigorous.
Yeah.
And the patients received Mexidol for 2 weeks, and then the pill version of Mexidol, intravenous Mexidol for 2 weeks, and then the pill version of Mexidol for 60 days. And then kind of assessed during that time their symptoms, their anxiety, their physical function in comparison to the placebo group. And the results were very, very encouraging. Like it's actually showed that Mexidol treatment was both safe and led to significant improvements in overall symptoms, anxiety, and physical function compared to the placebo.
That's crazy.
So yeah,
it works very
this
well.
is a good sized study that has, that showed both its safety and its ability to treat these areas, in humans.
Yeah, and it just kind of goes to show how wide-ranging of an effect it has. Because there was another study with humans, it was 205 humans. Now it was a preliminary study, so it wasn't like double-blind randomized test. It wasn't non-randomized, but they pretty much took 205 patients with lower back pain, and they gave them Emoxypine Succinate. And
oh God, I wish I was part of that study.
I know, seriously. Pretty much the results was that the Emoxypine group pretty much had a significant reduction in nerve pain over the standard procedure for lower back pain with the other group. And so it showed a very significant reduction in not just the pain perception, but also the speed recovery of lower back, trauma and stuff. So that also goes to show that it's
even has implications for nerve damage and nerve pain. There was another human double-blind placebo-controlled randomized trial. It was done on 103 patients with open-angle glaucoma. And obviously, their goal there was to assess the potential effectiveness of Mexidol on treating, open-angle glaucoma. And the patients were either received, Mexidol or the placebo for 2 weeks. And their vision, their retinal photosensitivity, and ocular blood flow were all measured during that time. And the results, again, extremely encouraging, showed that Mexidol improved vision, their field and clarity in their vision, as well as increased retinal responsiveness to light, as well as enhanced the blood circulation in the eye.
Wow.
And that's pretty significant.
Yeah.
Like, to be able to improve something, like that, especially in something that is as nuanced and complex as like the eye, that's difficult to kind of treat.
Yeah. That is very interesting. It's like it's finding kind of the core mechanisms that it just is able to naturally stabilize in those in your eye and stuff through those nerves. That's pretty cool. I know you were talking about how it can help with alcohol recovery. One of the studies with rats was they were trying to assess if wait, hold on, that might not actually be Emoxypine Succinate. It's PGA.
Thinking of a different one.
Yeah, hold on, never mind. But one of the other ones that they did with rats that I thought was really interesting is that they were able to they gave rats Emoxypine, and they were able to actually see an increase in explorative curiosity. Yeah, and as well as curing depression-like symptoms.
Interesting.
Yeah, so like in their reduced. So usually in like for like swim tests, for example, if you reduce their mobility, then there are specific biomarkers that showcase like depressive-like behaviors, and those depressive-like behaviors were reduced by 24% in rats with Emoxypine, and as well as an increase of explorative curiosity like processes by 53%.
Whoa.
Yeah. And so that also have some pretty major implications for things like, novelty seeking, kind of like almost like more of like a teleological kind of purpose-driven mechanism that is kind of modulating there. Yeah. And so that's kind of, it's almost like a partial curiosity nootropic,
Yeah. There's
cool.
A human study that was actually done to determine the effectiveness and ratio of effectiveness kind of the different administration routes of Mexidol, intravenous versus oral, to see if one was like more effective than the other, and just kind of for information purposes, so that anybody interested in in knowing more about this compound, kind of in case they have that question, of which route is more effective or viable. The results of the study actually showed that that both routes seem to be just about equally effective.
Nice. So it doesn't really matter how you take it.
Yeah.
So I don't need to inject it in my veins. No. Okay.
Not unless you want to.
I mean, just for the kicks and giggles, I guess.
Yeah, just for the shits and giggles. And there's been other studies done on it. Like there was one study done on humans that was done to determine the efficacy of using Emoxypine for alcohol withdrawal. And this was again, a double-blind placebo-controlled trial, and basically it showed that it could, and specifically it was shown to be able to speed up the reduction in anxiety symptoms by 25 to 50%, as well as certain depressive symptoms by up to 30%.
That makes sense. It's kind of allowing for the upbringing of a baseline state, kind of like those. It's minimizing the withdrawal symptoms by providing the valuable energy and resources for recovery in a quicker and better way. One of the things that I also found interesting was the study on Mexidol for ADHD.
Yeah, in children.
Yeah, in children. And they showed that if you that specifically like orally twice a day, then you would have a significant effect with reducing ADHD symptoms in children, which I thought was really interesting.
Yeah. So the study was actually a fairly large study too.
Mm-hmm.
It was like 333.
Yeah, over like 14
children.
different facilities in Russia.
Yeah.
Mm-hmm. It was pretty insane. It was a great study. I found it when I found the. Go ahead.
It was done both with high dose, low dose, and placebo.
Mm-hmm.
Had multiple symptoms, that were kind of tracked daily there. Mm-hmm. Go ahead.
Oh, well, I was just going to say it took me a really long time to find the original study that was being done. I had to like press through all of these different kind of sketchy links, but then the research ended up being very fascinating. And it's really something that maybe if I, felt a little skeptical about giving, my 8-year-old who has ADHD Adderall, for example, maybe if I want to wait until a little bit older to do that, maybe looking at something like Emoxypine Succinate that has, just overall very good health benefits.
If it, were approved in this area, unfortunately, it's only right now approved in Russia. So
yeah, if I ever move to Russia, maybe I'll do that. I'll send my kids over to Russia and go teach them. They can go learn some
specifically like some specific numbers, from these studies to kind of take a look at was the study with the rats on the BDNF production, the post recovery from ischemic strokes. That was done on rats. One of the first ones we mentioned, I believe. The level of necrotic brain tissue measured in the Emoxypine versus the control group was the total reduction in tissue volume, necrotic tissue volume was reduced by 20%.
Nice.
Yeah.
Yeah. Oh my goodness.
That was in comparison to the placebo. So in comparison to the body's natural recovery, it was improved
by 20%.
And
that's pretty huge.
Yeah, in the other like clinical study, or sorry, the preclinical study on rats on BDNF and strokes, another stroke model, the Emoxypine group improved the expression of some key growth factors in BDNF by 160%.
160%.
Not in 60% over the control group.
Okay.
But 160% total
overall.
And it increased NGF, sorry, by 150%. IGF-1 by 140% and VEGF by 175%.
Dang. Sitting on a lot. It's so interesting how it's, fairly dramatically increasing the production of those growth factors right there.
Yeah, and in the human controlled trial for the same disease, the chronic brain ischemia, the actual MIMO scores differences between placebo and Emoxypine. The placebo got a MoCA score of 1.5, and the Emoxypine group got a MoCA score of 3.2. so much higher.
Yeah, that's definitely a lot higher.
That's
pretty great.
Over twice as much. Yeah.
Yeah. I was gonna say that. All right. So, is there any kind of final remarks you kind of want to add?
I think just more call for more research,
yes,
on this stuff.
Yes.
Like the more research, the better.
Absolutely.
And get it approved. Hopefully,
please,
within our system, that would be nice. And
exactly.
Like I could even see it being applicable for things like hedonia.
Yeah, absolutely. That
symptoms.
Novelty, exploratory kind of aspect.
Yeah, like the kind of depression that comes from lack of, finding reward in anything. The fact that it has such an effect on both blood-brain barrier, dopamine levels, ATP function, as well as that study that showed the curiosity increase and the lack of, or the decrease in depressive symptoms. That seems to be something that would be really applicable for that.
Yeah, and we haven't even touched on the fact that it's able to inhibit plate aggregation, and as well as like overabundance of iron, because that happens as we age. Is we get an overproduction of iron, which leads to plate aggregation, which usually leads to Alzheimer's disease. And so it actually has very large implications.
Good preventative measure there.
On Alzheimer's disease. And, it's its ability to non-specifically target almost every single specific pathway in both your peripheral and central nervous system is so interesting, with such a great safety profile too. Because I think it's just structural similarity to very key vital components of our cellular architecture. And that's Emoxypine Succinate, quite the Davinci drug.
Indeed.
We'll say.
Indeed.
Yes.
All right. Well, I think we'll wrap it up there for tonight. This has been fascinating,
Very
and
fascinating.
we are going to be going over next week a machine learning topic.
Oh yeah, it's gonna be fun.
And so that should be fun. We can look forward to that. And I think we already have our next new topic lined up too.
Yeah.
Bromanthane. We'll be going over bromanthane.
That's gonna be a fun one. I'm excited for that.
Yeah, there's a lot of good stuff and research out there.
Absolutely.
Really fascinating when you delve into it. But thank you guys so much for joining us. We really appreciate it.
Yes.
And we will we'll be here again next week. And be sure to join us then. Thank you so much.
See you guys.
Gotta go over there and stop it because my computer just died. So.
Oh, perfect. Stay with us a little longer.